Today we will be talking about the bilateral hip and knee flexion test. This test is used to assess the flexibility and mobility of the hip and knee. The hip flexors help flex the hip. Within the hip flexors, you have the iliopsoas, which is attached to the lumbar spine and pelvis. The hamstring help extend the hips and flex the knee. The ischial tuberosity connects to the tibia. The core muscles, which are attached to the pelvis and spine, help stabilize the pelvis and trunk during movement. Step by step. Start with the participant having their gluteal folds on the edge of the table. Then have the participant lay on the table in a supine position, making sure they are relaxed. Then flex their knees and hips towards the chest line without lifting their lower back off of the surface or tilting their pelvis. Then place the inclinometer on the posterior area of the thigh. Quantification and analysis. Summary of the results indicate that the participant is not in the normative range, as the numbers for the left leg was 146.5 degrees and the right leg was 156.2 degrees. The normative range is 120 to 140 degrees. It was shown that the participant had a posterior pelvic tilt and showed hypermobility. The asymmetry cutoff is 10%. The qualitative cutoffs help identify any limitations or imbalances. A sport that can have an impact is martial arts, for example, with kicking. Conclusion. The results above show that the participant could be high in flexibility due to having an above average range of motion. The asymmetry was 6.21%. Although this indicates that this is within the 10% range, we can observe that the difference in measurements can potentially lead to an uneven load distribution and imbalance.